Chapter 11, Endocrine, Metabolic, Nutritional Diseases, and Immune System Disorders. Diabetes is a chronic disorder of impaired carbohydrate, protein, and fat metabolism. Diabetes can be caused by either an absolute decrease in the amount of insulin secreted by the pancreas, known as type 1, or a reduction in biological effectiveness of the insulin secreted, known as type 2. Other conditions include the term diabetes, such as Brown's diabetes and diabetes insipidus. But a diagnosis of diabetes without further clarification should be interpreted as diabetes mellitus. Type 2 diabetes is more prevalent than any other type. When coding diabetes, in order for the code to be valid, it must contain 5 digits. The 4th digit identifies the presence of any associated complication, and the 5th digit subclassification includes both the type of diabetes and whether or not it is considered to be out of control. There are 3 types of diabetes. Type 1, also described as ketosis-prone, juvenile type, juvenile onset, or juvenile diabetes. With type 1 diabetes, the body does not produce insulin at all, or there is an absolute decrease in production. These patients require regular insulin injections to sustain life and experience significant health problems if they do not follow a proper diet or medication plan. Type 2 is sometimes described as ketosis resistant. Patients with type 2 diabetes do produce insulin, but either it is an insufficient quantity or the body is unable to utilize it adequately. These patients usually do not require insulin and can ordinarily manage their diabetes with oral hypoglycemic agents, diet, and exercise. Some patients may require insulin therapy to control persistent hyperglycemia, and an additional code of V58.67 is assigned. When the provider does not document the type of diabetes, then type 2 is the default code. Secondary diabetes is usually the result of therapies, such as surgical removal of the pancreas or pancreatectomy, malignant neoplasm of the pancreas, an infection, or the use of certain medications. Secondary diabetes is coded as follows: if drug-induced, chemically induced, due to post-carcinoma state of the pancreas, or due to infection, code to Category 249, secondary diabetes. Never assign a code from Category 250 when coding secondary diabetes. Steroid-induced diabetes mellitus due to a prolonged use of corticosteroids for an unrelated condition is coded to 249.00, secondary diabetes without mention of complication, not stated as uncontrolled or unspecified, and code E932.0, adverse effect of therapeutic use of adrenal corticosteroids. Diabetes due to pancreatectomy, you would assign code 251.3 post-surgical hypoinsulinemia, a code from Category 249, and either a code V88.11 or V88.12 to indicate a total or partial absence of the pancreas. Out of control and uncontrolled diabetes are synonymous in this context. Poorly controlled or poor controlled are vague terms and do not necessarily indicate uncontrolled blood glucose levels. Code as uncontrolled only when indicated by the physician. Uncontrolled diabetes mellitus is a nonspecific term indicating that the patient's blood sugar level is not kept within acceptable levels by his or her current treatment regimen. Causes of uncontrolled diabetes may be noncompliance, insulin resistance, dietary indiscretion, and intercurrent illnesses. If the provider states borderline diabetes without further complication or confirmation of the disease, then it is coded to 790.2, abnormal glucose. When a type 2 diabetic patient or patient with secondary diabetes routinely uses insulin, assign code V58.67 for long-term or current use of insulin as an additional code. Code V58.67 should not be used if insulin is given temporarily to bring the patient's blood sugar under control during an encounter. Some type 1 diabetics require the use of an insulin pump to receive insulin therapy. Failure or malfunction of the pump may result in underdosing or overdosing of insulin and is considered a mechanical complication. These are assigned to code 996.57, mechanical complication due to an insulin pump. When there is an overdose of insulin as a result of pump malfunction, code 962.3, poisoning by insulins and anti-diabetic agents, as an additional code. Assign as many codes from Category 250 as possible and as necessary to identify all associated diabetic conditions the patient may have. Common complications of diabetes include chronic kidney disease, neuropathy, and retinopathy. Patients with diabetes are prone to kidney complications such as nephritis, nephrosis, or chronic kidney disease. Diabetic nephropathy is coded to 249.4 or 250.4 and 583.81, nephritis and nephropathy, not specified as acute or chronic. Or to 249.4 and 250.4 and code 582.8 when the renal condition is described as chronic glomerulonephritis. Diabetes with nephrosis or nephrotic syndrome is coded to 249.4 or 250.4 and code 581.81, nephrotic syndrome and diseases classified elsewhere. When the renal condition has progressed to chronic kidney disease, the diagnosis is sometimes stated in a way that it appears to require 3 codes, one for the diabetes, one for the interim manifestation of 581.81, and one for the final and current problem, 585, for chronic kidney disease. It is not necessary to code the intermediate condition, but all 3 codes may be assigned if the hospital prefers. Most facilities assign only the diabetes with the chronic kidney disease code. Patients who have both diabetes and hypertension also may develop chronic kidney disease as a result. 3 codes are required. The code for diabetes with renal manifestation, either 249.4 or 250.4. A second code from Category 403 or 404, with a 5th digit of a 0 with chronic kidney disease stage 1 through 4, or a 5th digit of a 1 with chronic kidney disease stage 5 or renal disease. And a third code from Category 585 to indicate a specific stage of chronic kidney disease. No other manifestation code is assigned. Retinopathy is another common complication of diabetes. Any disease of the retina is said to be due to diabetes requires a code of 249.5 or 250.5 and an additional code for the retinal complication. Non-proliferative diabetic retinopathy may be specified as mild to code 362.04, moderate code 362.05, or severe code 362.06. Assign code 362.03 when the degree of severity of the diabetic retinopathy is not specified. Diabetic macular edema is only present with diabetic retinopathy. Therefore, if the documentation refers to diabetic macular edema, code 362.07 must be used with a code for diabetic retinopathy from the range of 362.01 to 362.06. Senile cataracts develop more frequently in patients with diabetes, but they are not true diabetic cataracts and are not classified as ocular manifestations of the disease. A code from subcategory 366.1 for senile cataract and a code from either 249 or 250 should be assigned for senile cataracts in a diabetic patient, with sequencing depending on the circumstances of admission. Diabetic cataracts, known as snowflake cataracts or true diabetic cataract, is relatively rare. Assign codes for diabetic cataract only when the physician specifically describes the condition as such. Neuropathy is another chronic manifestation of diabetes. Patient condition can include peripheral, cranial, and autonomic neuropathy. Peripheral polyneuropathy codes 249.6 and 250.6 and 357.2 polyneuropathy and diabetes. Autonomic neuropathy codes 249.6 or 250.6 and 337.1 peripheral autonomic neuropathy and disorders not elsewhere classified. Do not use the code for autonomic neuropathy unless the diagnostic is stated as such by the physician. If the neurological condition is specified, assign the code for a more specific manifestation. Words such as with mention of, associated with, or in indicate both elements in the title must be present in the diagnostic or procedural statement. Although these terms do not necessarily indicate a cause-effect relationship, they occur together much of the time, and the classification system indicates this. Acute metabolic complications include ketoacidosis, hyperosmolality with or without coma. Type 2 diabetics seldom develop ketoacidosis. You would classify as type 1 diabetes mellitus uncontrolled. Diabetic ketoacidosis by definition is uncontrolled, and 250.13 is the default unless the physician specifically identifies it as type 2. Diabetes with hyperosmolality most often occurs with patients with type 2 diabetes. Coma may or may not be present. Diabetes with other coma includes patients with ketoacidosis who have progressed to a comatose state. This code includes hypoglycemic coma in a patient with diabetes and insulin coma, not otherwise specified. Although arterial sclerosis occurs early and more extensively in diabetic patients, coronary artery disease, cardiomyopathy, and cerebrovascular disease are not complications of diabetes and are not included in code 249.7 or 250.7. These conditions would be coded separately unless the physician indicates a causal relationship. Ulcers are also common in diabetic patients and may result from either diabetic neuropathy for 249.6 or 250.6 or diabetic peripheral vascular disease coded to 249.7 or 250.7. Just because a patient is diabetic and has an ulcer does not necessarily mean the ulcer is diabetic. You must query the physician or provider when they do not specify diabetic ulcer. Diabetes inevitably complicates the pregnant state, is aggravated by pregnancy, or may be the main cause for obstetrical care. Code 648.0 is sequenced first with an additional code from 249 or 250 to indicate the type of diabetes. Code also V58.67 for long-term use of insulin when diabetes mellitus is routinely treated with insulin. Gestational diabetes, however, refers to abnormal glucose tolerance during pregnancy in a previously non-diabetic woman. Gestational diabetes is not true diabetes mellitus. Gestational diabetes is thought to be due to metabolic or hormonal changes that occur during pregnancy and usually resolves during the postpartum period. Never use code 648.0 or 648.8 glucose tolerance complicating pregnancy on the same record. When a normal infant is born to a diabetic mother and the infant presents no manifestations of the diabetic mother syndrome, you would assign code V30.00 for single live-born born in hospital delivered without mention of C-section as principal diagnosis, an additional code of V18.0, family history of certain other specified conditions, diabetes mellitus. If the infant is being observed for suspected complication related to the diabetes and there is no definitive findings, you would code Code V29.3, Observation and Evaluation of Newborn and Infants for Suspected Condition Not Found, or for observation for suspected genetic or metabolic conditions. Newborns with diabetic mothers sometimes experience either a transient decrease in blood sugar, 775.0, or transient hyperglycemia, 775.1. The fact that the mother has diabetes in itself does not warrant the assignment of one of these two codes for the newborn. When laboratory reports seem to indicate either condition, it is appropriate and you are encouraged to check with a physician. If the diabetic patient experiences hypoglycemia, it is coded based on whether or not the patient has a coma or mention of no coma. If the patient has a coma, then the code is based on either type of diabetes, 249.3 or 250.3, or the patient does not have a coma, then the code assignment is 249.8 or 250.8. Hypoglycemia due to a drug used as prescribed requires an additional E code to indicate the responsible drugs. Hypoglycemic shock or coma resulting from the incorrect use of insulin or anti-diabetic agent is coded as a poisoning, with codes 962.3 and E858.0. Nutritional disorders include deficiencies of specific vitamins and minerals and are classified to categories 260 to 269, except for deficiency anemias, which are classified to 280 to 281.9. Obesity codes may be assigned as a principal diagnosis when the underlying cause has not been identified, or they also may be used as secondary diagnoses. Obesity due to a specific cause, such as a thyroid disorder, is coded to the underlying condition. These codes are assigned only on the basis of a physician's diagnostic statement. Obesity codes require an additional code of V85.0 to V85.54 for the body mass index, or BMI. The BMI code assignment should be based on the medical record documentation, which may be found in the notes of other clinicians involved in the care of the patient, such as the dietitian or nurse. This is an exception to the guideline that requires the code assignment be based on the documentation of the physician or other qualified healthcare provider that is legally accountable for establishing the diagnosis. While BMI may be reported on the basis of another clinician's documentation, the codes for overweight, weight, and obesity should be based on the provider's documentation. Obesity can also lead to other conditions, such as obesity hypoventilation syndrome, also known as Pickwickian syndrome. Pickwickian syndrome is a sleep disorder where it causes the person to stop breathing for short periods of time while sleeping. The condition may be related to both obesity and neurological conditions. The effects of hemochromatosis are where iron can build up to 4 times the normal amount. Toxic levels affect pancreas, liver, heart, pituitary, thyroid, and joints. When left untreated, organs may fail, causing diabetes mellitus, arthritis, cirrhosis, hypothyroidism, myocardial infarction, and neurogenic diseases. Hemochromatosis is also known as bronze diabetes because of the color of the skin due to excess iron. There are 2 common types of fluid overload conditions. The first, fluid overload, is excessive accumulation of fluid in the body with no known cause. When fluid overload is a component of congestive heart failure, it is not coded separately. The second condition is transfusion-associated circulatory overload, also known as TACO. This occurs when the transfusion volume exceeds cardiovascular capacity. Symptoms include dyspnea, hypoxemia, elevated venous pressure, and pulmonary edema. Cystic fibrosis is a disease disorder of the exocrine glands that causes the accumulation of thick, tenacious mucus. It is the primary cause of pancreatic deficiency and chronic malabsorption in children. The symptoms primarily affect digestive and respiratory systems. Code assignments is based on the site of the manifestation. If a patient is admitted due to a complication of cystic fibrosis with pulmonary edema involvement, such as acute bronchitis, code the complication as the principal diagnosis, followed by the code of cystic fibrosis. Tumor lysis syndrome is a group of serious, potentially life-threatening metabolic disturbances which can develop spontaneously following radiation therapy or corticosteroid therapy, or following the administration of anti-cancer drugs, and often associated with leukemias and lymphomas. This condition can also be seen in other hematological malignancies and solid tumors.